Hello everyone, today we're going to be learning about pneumonia. So this is the next in the infectious diseases series. So by definition, pneumonia is an upper respiratory tract infection. There are two main types. There's community-acquired pneumonia, which occurs outside the hospital setting, and hospital-acquired pneumonia, which occurs 48 hours after a hospital admission. Now, there are many causative agents. You can see down below the many types. So there's Streptococcus pneumonia, which is the most common type of cause for community-acquired pneumonia. Staphylococcus aureus often happens after an influenza infection, Haemophilus influenzae after an infective exacerbation of COPD, and Klebsiella pneumonia is very common in alcoholics. Other ways that pneumonia can spread is from other respiratory tract infections such as bronchiectasis, and tuberculosis can then develop into pneumonia. Genetic conditions such as cystic fibrosis also increase the susceptibility of a person in pneumonia. Immunocompromised individuals, such as individuals with stroke, malignancy, young children, the elderly are also more susceptible to pneumonia. And pneumonia can also be common from outside aerobes, such as after a dental visit or someone with poor dental hygiene can also present with pneumonia due to the oropharyngeal anaerobes traveling and infecting the lungs. The common presentations, so the symptoms that the patients may experience include dizziness, shortness of breath, a green, frothy, or white sputum, potentially hemoptysis, pleuritic chest pain, and a fever. And signs that the doctor may then observe include tachycardia, pyrexia, cyanosis. Upon auscultation, there may be absent or reduced breath sounds, dullness to percussion, and a pleural rub. So on the right, we're going to now show you a chest x-ray of someone with pneumonia. As you can see around where the heart is, there's lots of consolidation. So consolidation is a classic sign of pneumonia on a chest x-ray. We can also take various tests to also confirm a diagnosis of pneumonia. So firstly, bedsides. We're going to be looking at O2 saturations, which will be quite low, high respirates, which is respirate over 18 breaths per minute. We can also do microbial tests such as bloods, where we'll find raised inflammatory markers, so raised CRP. Raised CRP over 2 indicates more severity, a greater severity of pneumonia. High neutrophil count, as well as sputum cultures, urine dipsticks for pneumococcal, and Legionella antigen tests can also confirm pneumonia. In patients who are immunocompromised or in ITU, we would also consider using bronchoscopy, and we can aspirate the pleural fluid to confirm pneumonia. A classic score that we use is the CURB-65 score. So C stands for confusion, this can U for urea, R for respirate, and B for blood pressure. A mental state of test of 8/10 signifies confusion, urea over 7 millimoles per liter, respiratory rate over 30 breaths or more, a diastolic pressure of 60, and a systolic of 90. Altogether are the indicators of the CURB-65 score. Now, if a patient has a CURB-65 score of 0, and they also present with the symptoms of pneumonia, we can treat that in the home with prescribing an oral antibiotic such as amoxicillin as a first-line intervention. However, if they have a CURB score of greater than 2, this is a much more greater severity of pneumonia, would need hospital admission. Within the hospital, the first thing we would do is use the CURB-65 score and CRP ratings to assess the severity of the pneumonia. And remember, a higher CURB-65 score means a greater severity. First line option would be to offer an antibiotic. So in community-acquired pneumonia, the first line choice of antibiotic would be amoxicillin 500 milligrams 3 times a day. If it is contraindicated, for example, the patient has a penicillin allergy or they're not tolerating the amoxicillin well, we can then give a second line drug, which is doxycycline 200 milligrams for the first day and 100 milligrams a day for 4 days, or clarithromycin, erythromycin. Secondly, other alternatives that we can provide is cocoximab 500 milligrams 3 times a day, which would be the classic first choice antibiotic to give if they present with a CURB-65 score of 3 or more. And further to that, we would also take a sputum test to reconfirm the diagnosis and to see the progression of the disease. And this is a nice guidelines for hospital-acquired pneumonia. You can have a read of that below. Thank you. That was a very brief summary of pneumonia. If you have any questions, please comment down in the comment section below. Thank you.